Ever wonder how you can affect policy change when you're struggling to keep up with all the daily demands of your work without feeling like time is basically slipping away from you? Well, you might be more influential than you think. I wasn't sure what I was exactly passionate about to advocate for a change, but once I started thinking about it, it was easy to pinpoint what was getting me excited. The US houses the largest volume of incarcerates in the world. Aside from the millions and millions of dollars poured into our health system each year, our newly released incarcerates really lack the basic access to care. The United States Social Security Act states that no incarcerates are allowed to get health insurance while incarcerated. Our society takes a tough approach on crime, but it's really the criminals that we're really hard on. Most incarcerates who re-enter into society often leave them without money and often have the hardest time getting access to care. Many of them try to get jobs, but even that requires criminal background checks. And quite frankly, if you don't pass it, you're not going to really be able to get a lot of chances to getting a job, much less then access to health care. So I know what you're thinking. So what can you really do to help these incarcerates get better access after they get released? Protest on Capitol Hill and rally like some of these candidates for hours and hours at a time? Who's got time for that stuff? Well, the answer is quite simpler than you think. Sure, I can rally and get by with a foghorn yelling at buildings hoping people hear me, but there's a smarter approach. Find who your local reps are. What is their stance? Do they have a proven track record of helping what they claim when they got elected? And if not, let's keep them accountable. Write letters, sign petitions, and yes, you can also rally. Other ways to help induce change is from the core, where you're working. What are your current policies? Do you practice what you preach? Or do you just need to do some preaching yourself? Find your stakeholders and practice an elevator speech to get them into a meeting. With their support, you can do evidence-based practice that yield convincing results for your own institution. Stay involved. Stay on your pulse. Do your homework. Join your state nurses association to get updates for the latest meets and discuss bills that affect change. And when you're so burnt out at night, but you can get on the internet, pull out your phone. Look at Facebook. Subscribe to YouTube. Listen to what your state reps are saying. What are the latest spiels that they're putting out there that's relevant to nursing? Finally, remember, don't give up. Some might feel different about how well politics work in our country, but let's face it, this is the game. Self-awareness also comes into play with passion. No matter how passionate we are about nursing, we still have to remember to be professionals. And with that being the largest profession in healthcare, we are a powerful force. This has been my whiteboard presentation on the DNP prepared nurse, how he or she can affect change for the Wilmington University DNP course 7104. Thank you for listening, and I appreciate any feedback you may have.